Guys, it's Tim O'Connor once again. It's Friday night popping off about politics, but you know what? Tonight is not actually about politics. All right. Libertarians love solutions, and who I have with me, guys, right now, Dr. Mark Barreto. He has a solution. Guys, we know there's a healthcare thing, there's an expense thing when it comes to it, there's finding a good doctor. Dr. Mark, I want you right now to riff off on what you're trying to do or what you're going to do, right? This is what you're going to do. So let's talk to the people about that.
So, hi, I'm Dr. Mark Barreto. Thank you so much for listening to us today. I'm actually starting a practice in the direct primary care model. The name of the practice is Barreto Family Medicine, and it's right in Otsego, New York. It's actually right out of my house. The idea here is that I want to bring small town country doctor medicine back because that's the way medicine was meant to be, and we have lost that in this crazy world of healthcare.
We know we have. We know.
Yeah. I mean, I don't know. Some of you guys might remember when doctors used to go to your house and make house calls. Well, I plan on doing that again. I remember when you were able to sit down with your doctor and have a drink and talk about your problems and not be rushed out the door in 10 or 15 minutes. That's what I want to do.
Oh, that's wonderful.
I want to be the guy that walks down the street and everybody knows, oh, there's Dr. Barreto. And hi, Dr. Barreto, and I'm at your baseball games and on the sidelines for the football games. And
all right. Hey, let me ask you a quick question. If I have 2 chickens and a mole on my neck, can we work out a deal?
Absolutely. Now,
all right, that's perfect.
I've been asked this question before, and I said, I like chickens, but if you have a goat, I would really like a goat because then you can do my lawn, and I won't have to, do it myself. So,
all right, so I might need 5 chickens to get a goat to bring you the goat and get the mole gone. All right. Yeah. So tell me more about the model. Let's go back into that. I don't want to cut you off, right? Let's go.
Yeah, no problem. So, this idea is based on direct primary care, which is not a new idea. It's been around for about a decade. And direct primary care is basically a membership model. So you pay a low monthly cost and you get unlimited services, 24/7 access to your doctor. You have unlimited number of visits. You want to come twice a week? You want to come every day? That's totally your prerogative. You can call me, you can text me, you can email me, you can do live video chat. So when you have that mole on the back of your neck, you don't even have to come to the doctor. You can say, tick, 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 tick. Hey, Dr. Mark, I got this thing on my neck. Can you take a look at it? I'm going to be like, tick, 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 tick. Yeah, put it up to your neck. Put your phone up to it and show me what it is. And I was like, oh, that's nothing. No big deal. That will just watch. Oh, okay. That looks like it's a little dangerous. Why don't I either come to your house or you can come to my office and I'll take it off right there. There's no extra charge. It's all included in the membership.
Okay, so what? All right, let's go right into the nuts and bolts of this. All right.
Okay.
This is costing somebody $1,000 a month, right? I mean, if I want to be, it's $12,000 a year to sign up. Is that the price? What's the number?
So unlike the concierge medicine of what you may have heard for the super rich, direct primary care is low cost. It's $100 a month for adults. Okay, so $100 you have a doctor in your pocket, as opposed to thousands of dollars, or the super rich can pay $10,000. That's what they used to do.
Right.
But we can certainly do it for a lot less because we're trying to see less patients and give them more direct care, and that doesn't cost that much. All it costs is somebody that wants to actually help your patient. You need to, that's the cost. The cost is your time, or my time, and it doesn't take a lot for you to come in and, have a seat and, for me to look at something. What costs a lot is when you have a whole large staff that has to do all this documentation and record keeping and following all these rules and regulations of the insurance companies that, make the doctor's office visit cost a whole few $100s for one visit. And then the insurance pays for it and you pay a copay. And, that's why the healthcare system costs so much. if you take all that out, and what did we do in our example? You called me. I looked at the thing. There's no third parties in there. There's no office staff. There's no insurance company saying, well, doctor, you have to order this, this, and this for us to pay for this. And that's all more claims. Why? Because the insurance company wants to make money. We don't have to deal with that.
So let me ask you this question. So first of all, as libertarians, we kind of hate insurance companies. I'll be honest with you. Not all of them. We see that we see their use in certain instances. But what you're saying is you're literally kind of cutting the insurance company out of the way, and that makes everything less expensive. And I know I'm being facetious almost, right? So is that what's really going on here?
It is and it isn't. Okay. Because for the most part, most of your care can be done in primary care. You treat your chronic diseases. You come in for an injury. We fix your injury. You come in because you're sick. We get you better. Those can all be done in primary care. The things that you still need insurance for is when you get in a car wreck and you're hospitalized, or you have cancer and you need radiation treatments. You have some kind of major life event, and that catastrophic event can not only, kill your health, but it'll kill your finances. And that's what insurance is for. It's for catastrophic events. We liken direct primary care to car insurance. Okay. You have car insurance because, if you get in a car wreck, you need somebody to take care of your car and the liability if you hit somebody else and such like that. But the car insurance doesn't pay for your gas. The car insurance doesn't go to get your oil changes. You pay for that out of pocket. And that's what direct primary care is. Instead of paying every time you go to the doctor with a copay or something like that, you pay a membership fee, and then you don't have to worry about every time you come in, I'm going to get nickeled and dimed. Oh, I need an EKG in Dr. Barreto's office? How much more is that going to cost? Nothing. It's all included. It's all part of primary care. So your primary care is taken care of by the membership fee, and there won't be any other costs.
Wow. Okay. So, all right. So we've witnessed over the last few years, we've witnessed this explosion, all right, in healthcare costs. We've witnessed this explosion in the size of deductibles that everybody pays. And I mean, it's a literal explosion. As an economics guy, I predicted it. You can go back 4 years on my Facebook page and you can see where I was saying, this is what's going to happen. Listen to me now and stop this before it gets too far. But all of a sudden, I'm like, this is a better deal. So it's fine. It's going to work out. If we find more guys like you who are committed to these concepts, we're going to make the world a better place. So when we're libertarianing it out and we're economicing it out, we're talking about steering a ship. We're talking about changing a political climate, and we're talking about let's call it small business. All right, this is a small business. We're talking about those guys, giving the reins to those guys to make the world a better place. And so I literally feel like that's what you're doing. So
I am, and it's not just me. There's all 3,500 other doctors in the United States doing direct primary care. It started about a decade ago, and it's more and more. About 15% of the new doctors are going into direct primary care models instead of working for a hospital or some kind of network. So it's certainly growing because it lets doctors be what they went to medical school for, not what, unfortunately, a lot of hospital networks and insurance companies have made doctors, where they basically says you're the guy that you're a doc in a box and you have to see, 15 to 20 patients a day, and you have 10 to 15 minutes to see each patient, and you got to see them and make them go through a mill. My visits are 30 to 60 minutes long because I want to sit there and talk to you and not actually treat you like a number. And unfortunately, the other system, in order for them to pay for it, they have to see volume. This idea doesn't have to see volume. As you said, it's a small practice model, but there are doctor offices that have 5 doctors that are doing this for a larger area, so it can be bigger than just my own office like mine is going to be. but it is a small business idea, and it is a small business idea that is going to change healthcare. It already is changing healthcare.
Yeah. Well, it sounds like it is to me. We're exploring a couple ideas. How can it benefit me? One of the things I noticed this year, we signed up for the wrong plan, right? And all of a sudden, we had like, I don't know, $8,000 worth of spend downs. I, I don't know. My wife could explain it better because we were just like, what's going on? Everything we went for was like $300. I went for a flu shot or a flu test. I don't really like vaccines, but whatever. You're going to handle vaccines for people that want them. And so, and I do believe in the science of vaccines, so I don't want to go off on a crazy tangent. I think there's rights there that people are entitled to, that they've earned, that, I don't want a vaccine, but you can feel free to disagree with me. So anyways, we're going through this whole monetary thing, and everything we were going for, it was like a problem or expensive. And so we had to kick it back down. And so now all of a sudden her paycheck is wrecked. It's just like, all right, how do we buy beans, man? So what do you think? Could we make a living there? Could we make some money there?
So there's two things that we talk about. We have decreasing the costs for employers and decreasing the cost for personal people. So I'd like to talk about employers first, because employers are the prime market to want to include a direct primary care in their healthcare, how they provide healthcare to their employees. So if they do something called a self-insured program or self-funded program, okay, right. They can decrease the amount of their premiums because the employees, the patients, are using the insurance less. It's all based on utilization. So an insurance premium, whatever they give to your company or whatever it is, say it's $1,000, okay, it's going to go up and down based on how often you're dinging. Oh, I need the insurance. Oh, I need that claim. I got to put that claim in. Got to put that claim. I got to put that. If all those claims, whether you're going in for a flu shot and it costs you a copay, or whether you're going in because you got a cold and it costs you a copay, and you end up going to the orthopedist because you stubbed your toe, or worse, you go to your primary care doctor and they say, oh, well, why don't you go to the in-network orthopedist, and they do a referral. Now you're getting twice dinged. Okay. All of those things go away. So what it's been shown, direct primary care can lower the insurance costs by 30 to 60% because you're no longer making claims on those insurances. Thus, the employees are getting all the health care they need to through direct primary care, using the insurance only for catastrophic events. That lowers the premiums because your utilization is less, because your claims are less, and that makes the employers happier. So the employers are now paying a right out of their self-insured thing is going to be going down. They're mingling the DPC for most primary care stuff, and then they're using the insurance only for catastrophic events. That's one way we save money.
Yeah. Well, let me interrupt for a second. Let me do a little self-promotion, guys. I have my GoFundMe link up on the page, and so there's value in what Dr. Mark is doing. I feel like there's value in what I'm trying to bring to Senate District 51. So if you can help me out with a little bit of money, that's going to be the bomb, guys. And sharing this, liking this, and talking about this with our friends is going to help get this message out. So let me go to a question that we had from a buddy of mine. This guy is great. He's literally a diehard libertarian. All right, he is. So. And it's interesting, just coincidentally, you and I had a conversation about this, right?
We sure did. So any ideas on bringing the price of medication down?
And he does, man, he does. I'm telling you right now, I don't want to be too excited, but go ahead, lay it on them. They're going to love this.
Absolutely. The cost of medication is wrapped up in third parties. The person that made the medication, they have to make their money back on whatever research and development they put into, plus the amount of marketing they did to get their drug to market, and to get people to buy it. So the actual cost of making the medication is pretty low. It's just adding all that millions on billions of dollars of all those TV ads and everything else.
Middlemen, all the way through.
Exactly.
And the government is a middleman in that process. But anyways, keep going, man. I didn't mean to interrupt you.
No problem, no problem. But then you have to think, okay, well, where do you actually go to the manufacturer of these medications to go pick up your drugs?
No.
Where do you go? You go to the pharmacy, right?
Yeah.
The pharmacy is a brick and mortar, and they need to pay for their bills, right? So there's another markup on that. Okay, so the insurance company has to pay for the final, dollar amount that is made up by the amount that the pharmacies are costing plus the amount that the manufacturers are charging for it, and they give you, whatever, $200, $800. It depends on what the medication is. Now, there's an amazing thing called generic medications. Generics are the same exact medications, and after they go off market after 7 years, after they go through their, they get 7 years of saying, okay, you can only use this medication as the name brand thing. After that, it goes generic. Anybody can make it. Okay, so during that time, you have to buy that thing, but you can buy it directly from the manufacturer at a wholesale price. But there's still up charges. There's the pharmacy and there's the insurance company.
Mm-hmm.
You can get the pills for pennies on the dollar if you can get it directly wholesale and get it to the patient directly wholesale. So 44 plus other states in the union can get those medications. The patients can get them directly from their doctor who bought them wholesale.
All right, can I just emphasize that point? New York State pretends to be a leader in all sorts of things, all right? But as I explore politics, as I try to bring a candidacy to the New York State Senate, to Senate District 51, I am finding that we are so far behind. It's almost embarrassing. We're living up in a, I don't know, man. Go ahead and keep going with what you were saying, but I get frustrated and I wanted to emphasize it.
So New York State is well known to be lots of rules, lots of regulations, lots of law. Well, there's a law that basically says that doctors can't dispense the medication they prescribe except for a 3-day supply. So you can't get your metformin for diabetes for a 30 or 90-day supply from your doctor. You have to go to the pharmacy. So they're forcing us to use the pathway that the insurance companies have made that are going to basically make the money. You have to pay a copay. You got to do this. Other states have basically made it so that they can get that drug that would cost you a $10 copay or a $15 copay. Other states have made it so that you can get those into the doctor's office, and the doctor's office say, okay, here's your 90-day supply, and it costs you 30 cents. Okay? Unfortunately, we can't do that in New York State. I would like that to happen. And other states are currently in lawsuits so that they can get those, like Montana and Texas. And again, 44 other states have already turned that corner and said, yeah, go ahead. Go for your doctor.
Hang on, I want to ask a question, if you don't mind. Why can't we do that in New York State?
If you want to go abstract, it's because somebody made some rule in the Congress, and how Congress works, or any of these lawmakers work, is that they have, they have lobbyists, and lobbyists basically pat the shoulders of the lawmakers, and the lawmakers shake hands, and they make rules and such that are in their pockets, and that's why it happens. I don't know.
Here's how libertarians phrase that. Our politicians sell regulations to rich people. Does that make sense? And I know, right? You are here to sell an idea. I am here to help you sell that idea. I did promise I'd do my best to not be too political, but okay, so I shortened it up, but whatever. Listen, I love what you're doing. Yeah, see, got a libertarian. He agrees with me. I love that guy.
But I can say that most likely, just like they did with their Medicare debacle, there were Medicare can't change their prices and such like that. it's all these backroom deals that, whatever. I don't know. I'm not really involved with it, but I know it exists. And unfortunately, that is probably what has made New York State unable to allow their doctors to get medications to their patients.
It's a little early in the show for this, but I want to welcome you to the Libertarian Party. I just want to say, I mean, I'm going to do it again. I know that. So look, another thing that libertarians talk about, and everybody, even Democrats and maybe a few Republicans talk about it. We're running into this situation where there's this crisis with drug use and drug sales. And so we just happened upon this conversation when we were warming up for our conversation now. And frankly, your model does what? Tell the folks what your model does and who you are when it comes to this piece of it.
So we all know, or maybe we don't know, but you should know that there is an opiate epidemic going on in this country. And while there is certainly the COVID pandemic going on, the opiate epidemic is still killing people every day. So there's a problem with getting patients who want to change to that have substance use disorder and want to change. They want help. They can't get help. So there has now been this relatively new certification called the MAT waiver that certain providers can get. And MAT is medication-assisted treatment. And I happen to have that certification. So I am offering my patients, if they have substance use disorder and they'd like to change their lives, I am certainly providing that to my patients. And I hope I can help as many people as I can. With this waiver, I'm allowed to prescribe certain medications that helps people get off their heroin, get off of some of the opiates that they've been addicted to that are ruining their lives. And I'm glad to be able to do that at the practice. And it doesn't cost any different. It's
$100 a month.
That's right.
100. So how many patients do you want to serve? Like 10,000? You need 10,000 to make a living there, right? 10,000 patients at $100 a month. So, and that's what I see the numbers working at, based on the system as I understand it.
So certainly not 10,000. So when I was in my private practice with some of the other hospital networks, or when I was most recently with the VA, I had patient panels to 1,000 to 1,300 patients. It was very hard to see that many patients. My practice, I'm trying to limit to 200 to 300 patients.
Okay.
The reason why I want to do that is because, I want time to spend with my patients to build that doctor-patient relationship that, it's all but gone in the system where you have to see everybody every 10 or 15 minutes. I can now see them for 30 to 60 minutes, but I can only do that because I have a low patient panel number that I'm going for. 200 to 300 patients, I can spend the time I need to give you the care that you actually want, that you need, that you deserve.
You're talking about it feels like I can still remember my pediatrician when I was a kid, Dr. Cannon, right? And he was like, and sometimes maybe I was a little hypochondriac when I was younger. I grew out of it, but he was just like, go have fun, kid. Get out of here. Stop making your mom bring me here. It was a good kind of, he knew who I was. He learned about who I was. And so you're literally going to bring that back. And it's kind of thanks to this, almost what I would call a government malfeasance or guys, when we force, and guys, I'm going to get libertarian on you, so hang on. Like, we force people to buy a product like insurance because they're equating the product with healthcare, and it doesn't quite meet up with our reality. So now Dr. Mark has found a hole to bring back what's a good deal. Like, it feels awesome to me.
I just can't say that I can't take all this credit.
I know.
There are pathfinders that blaze this path for me for the last 10 years and have made this all possible. If anybody's really interested in knowing people that have saved people hundreds of thousands of dollars and companies thousands of dollars in their premiums and stuff like that, it's Atlas MD. Atlas.md is the EMR system. They're the company that did this starting back in 2010. And they've spread it, and they're the ones teaching other DPCs to do this kind of thing to help our patients, to get out of the rut of the healthcare system that is broken in America. There's doctors that are in Oneonta right now that are doing this. There's one other doctor, Dr. Hoffman, and the Hoffman,
Awesome.
yes, Hoffman Family
Awesome.
Medicine. And the thing is, we're not competing with each other. We're helping each other. We have a direct primary care alliance. It's called the DPC Alliance. And
we love our anachronisms. We love them. We love them.
Yeah, we're trying to help people do medicine like they thought medicine would be, and not have to worry about sitting there coding everything and upcharging things and making people spend more money. Oh, you got to come back in 2 weeks. So, we charge another copay. So this is all included. You have a procedure, doesn't matter. You come back the next week. For a cold, doesn't matter. It's all included. We don't try to get you to do more than you need to, because we don't make any additional money on it.
Yeah.
If we have a membership fee, okay, and it's $100 and all is included, then it doesn't matter if you see us 100 times or one time. And you don't have to come in and say, oh, I think I might need that EKG, but I don't want to pay the $100 for it. Well, it's included. You don't have to worry about it. And I think more importantly than that is that I feel like I want to serve people that can't always get service. And there is an elderly population in this world.
Yeah, there is.
And there's people that are disabled. And there are people that can't get out of their house. And remember those things called home visits? Well, I'm doing home visits again.
Oh my God.
Especially for our elderly patients that don't want to, just getting out of their bed and into the car and driving all the way to over here can be detrimental for, people that have dementia and such like that. Well,
oh my God, yeah, absolutely.
And more than that, people that are taking care of these people, they don't always have the time. They're working during the day and they're going home to their loved ones at night. And when are they going to get them out of their house, bring them over to the doctor's office? Well, now you don't have to. You can get on the computer. We can do a telemedicine visit, or I can come visit you over now. What if you're in the middle of your job and you have something going on that you can't leave? You can't leave your job. So get on the phone, call Dr. Barreto, and it's like, okay, we'll take care of it over the phone. And I don't have to make you come in so that I get an extra copay, because there's no copays. There's
no copays, zero copays. That's right. What, am I hearing you right? Because
there are zero copays.
Become a way of life. There was a time not that long ago. Check this out. You could go, your kid would be sick, the doctor would automatically bring you back in a week, and there was no copay. Yeah. Now there's a copay. Every single time you go, there's a copay. So here, being a small business guy, right, I always struggled. I always wanted to provide my guys with health insurance. Always wanted to. And I'm looking at numbers like $5,000 a guy, $8,000 a guy, $9,000 a guy. So all of a sudden, I could spend $1,200 a guy is what I'm hearing.
Yes, sir.
And they could get all sorts of health care. And then I would have workers' comp if they got injured on the job. So all of a sudden, I could add this benefit that I could afford, right, and my guys would have been happier, right? Like,
exactly right.
Where were you 5 years ago, brother?
Well, a lot of companies are doing, they're sharing it with their employees, where it's $100 a month. First of all, if you have so many employees or whatever, there's probably going to be a discount. But
right, there we go. I would, yeah. We negotiate.
But so the patients can pay, $20 of the dollars, and you pay the $60. You know what I mean? So it's not even necessarily $100 out of your pocket. You can share it with your employees.
Yeah, for $50 and 50. Listen, I'm telling you, these kind of ideas, and look, man, I harp on it. I look around, I see houses falling in the ground. I see farms going bankrupt. I see people leaving this state every day. But ideas like this, okay, if we can bring this back, if we can we can lead. We can lead. We can go back to leading. Central New York at one point was an economic leadership dynamic. I mean, we had people, we had trains, we had houses, and we had ideas and solutions, and we respected each other. And somehow we've lost that over the years. But guys like you and guys like me can bring this back, right?
And I agree. And there's definitely some questions that I'm seeing on this thing that I'd like to
Yeah, let me hit you with one. This is my biggest fan in the whole entire world. She wants to know if you've seen a person with COVID.
Yes, I've seen patients with COVID. I currently work for the VA, and I love the veterans. The veterans are wonderful.
God bless you, brother. We all we all appreciate that. That is a good way. It's a good thing to do.
So I've worked for 5 years for the VA. So yes, we do see patients with COVID. What is your question about it?
Well, we've been talking, and again, I do a couple podcasts, and one of the things that concerns me, and again, I don't want to put you on the political hot seat. My biggest supporter was just wondering, so I don't want to put you on a political hot seat, but we are, as libertarians, most of it, and we're a little bit uncomfortable with what we perceive to be an overreaction or a top-down mandated structure that doesn't serve our communities. Basically, it destroyed so many businesses in our local community, hurt local business owners who always have gone out of their way to serve their neighbor. Okay, and if I'm telling you, I trust a guy like you. I trust way more than I trust a big business. Okay, so if somebody wants to cut my kid's hair, would I think that person would do anything that would give my kid COVID? They would take every precaution recommended by Dr. Mark to prevent that from happening, right? So that's where we're at, the libertarian stuff. How do you feel about what I said? Am I making you uncomfortable or?
No, you're not making me uncomfortable, but I do want to clarify for anybody that has any questions. COVID is real. People are dying of COVID. We've just reached 124,000 Americans that have died of COVID. There are people dying every day of COVID, and you have to be very careful about the return to normality. We're never going to get back to normality like we knew it before. But if we push it too fast, you're going to see things that are happening down in the Midwest and the lower states of the Union, that you're seeing upticks in the amount of COVID cases that are coming on. So you still need to follow the precautions. You still need to social distance. You still need to wear your masks. You still got to wash your hands, and you still got to keep the numbers of people together small. That said, I hear you about doctors, or not just doctor's offices, but doctors' offices are affected too, where people are losing their small businesses, including doctors' offices, because of this COVID pandemic. That it's a reality. I don't know the answer on how to fix it. I do know the answer on how to keep people from spreading it and making it bigger. And unfortunately, right now, that is to kind of use the precautions, be on the more safe side than cavalier. But again, people need to make their money. There is a balance. It's not only economic balance, but there's a social balance. People are getting stir crazy, and a lot of people need socialization. That's part of health as well. Economic health is part of physical health. So I understand that medicine and the economics, and it's all complicated. I don't have the answer, but I do hear you that small businesses are suffering.
So I feel like this isn't a libertarian point. So I want to put it out there. There's a comorbidity to this economic lockdown. Okay, people are using drugs. People are using drugs more, and So we're, and again, I don't want to force you down. Let's go to my buddy Andrew. Andrew is running for town supervisor out in Maryland. He's a young man, and he's who I'm trying to encourage to get into politics. Like, dude, I want these kids to come along and be like, you know who's horrible at this? Tim O'Connor. Get out of my way. I'm making New York State better. I can do what you're doing better than you're doing it. Okay. So Andrew Hamill has a question, and go ahead and see what you got there. Can you see it all right? The question?
I can. It says, Dr. Mark, medical doctors belong to a union like the way teachers belong to a union. So, I have been in trouble many times for trying to quote unquote unionize doctors.
Okay.
It is apparently somehow, I don't know, I'm not a lawyer, but from what I've been told from medical school on out, is that unionizing doctors is illegal. You can't unionize doctors because you can't just, walk out as a group from certain things. It's, against being able to take care of your patient. But there are things that doctors can do as a group that have more power if they were able to quote unquote unionize, but they're not. They're not allowed to. We do have forces that say our piece, like the AAFP in my case, the American Academy of Family Physicians, the AMA, the American Medical Association. There are associations that we work together, but we can't be a union.
Interesting.
But maybe you can change that.
Well, so as a libertarian, right? Let's put it out there. I'm not, and I love my teacher friends, guys. Like, they work hard. They're members of my community. They're literally, when the economic consequences of COVID, they're going to be on the chopping block, and I'm here to try to help them. But I don't like public sector unions, and probably watch me lose 10 viewers right now. Sorry, okay? But the reality is, public sector unions are negotiating with the government. Private sector unions are negotiating with the business, making money on people. So I am a big fan of people joining a union to negotiate with a big business, because that's reality. Okay, those guys are paying for regulations, so by God, the people that are working for them should have a say. All right, they should be able to stand together and say, look, this is what you've got to pay us, and blah blah blah. All right, so I don't want to belabor this point. So I'm not sure where doctors unionizing is an interesting concept. I've never heard it before.
Because
and if you want to try to sell it some more, I'm more than willing to let you do that. All right. What would be the benefits to society if doctors formed a union? Because we know you have the AMA, we know you have a couple other seeming like union things to us, right? So you have a couple other organizations that make statements on your behalf. So how could a union benefit the medical profession? Sorry.
I think the medical profession, unfortunately, has let the insurance companies run away with healthcare. Starting from the 80s, that's what happened. Basically, doctors wanted to be doctors. They didn't want to be business people for the most part. And the insurance company says, well, we'll run it. Don't worry about it. If you guys don't want to do that part, you guys do the medicine. We'll do the payment. And the doctor said, okay. I can just go in and see my patients and not have to worry about the other stuff. Well, now we have to worry about the other stuff.
Right.
So where would a union have helped? Probably there.
Right. Okay. I get it. You guys as a union could have fought the insurance companies.
Right. And I think that's
once again, I want to welcome you to the Libertarian Party. Sorry to cut you off, but I'm just saying that's a great idea.
So I think right now, whether you call it a union or whether you call it, or an organization like the AMA or whatever, doctors still need to be a force to be reckoned with. The problem is that all forces to be reckoned with come down to how much money they have.
Yeah.
The AMA is never going to beat the insurance companies or the pharmaceutical companies in the legislation in terms of money. They have billions of dollars to spend on lobbyists. We don't have that. So
no, right. No one has it. They have it. They have enough money to pay again, to buy regulations on the floor of any Senate anywhere in any state. So I'm with you on that, man. And the way you put it now, all of a sudden that makes sense. You guys are like a union. You're fighting insurance companies and saying that's too much work. That's nonsense. We need to serve our patients. We're serving our neighbors. We're making our community better. And guys, that's where we stand. So again, I don't want to put it into politics. I warned you I would a little bit. So, anyways, and again, my biggest supporter wants to highlight one of the things you said. She took care of an elderly, her mom, who was suffering from an illness, and her mom never wanted to leave the house. And your program is going to be better than that, right? It's an instantaneous improvement.
And honestly, it's not only helping the patient by bringing care and access to them by doing home visits, but it actually helps the doctor understand the patient by seeing them in their own environment. And I think people have forgotten about that, or doctors have forgotten about that. When I was a medical student, we did home visits. We learned what is it like to see somebody in their own environment, and that environment can change how people's health are. And it's something that is forgotten about, but we can certainly bring back.
Yeah. So Shannon, right here, Shannon Turner Bell. Private physician practices are a minority, as they are not a majority, right? As a group, they can negotiate better rates of pay from insurance companies. I think what I heard Dr. Mark say, and correct me if I'm wrong, you are cutting out insurance policies from your practice. Is that correct?
That's absolutely right. So I don't get paid by the insurance company. I get paid directly by the patient, which means I work for the patient, not for the insurance company.
We love that, man. That is localization at the individual level. And guys, again, the individual is the system that we created. Okay, that's who we're supposed to serve. We're supposed to serve our neighbors. We're supposed to serve each other, because that's where our rewards are. That's what feels good. When we start serving insurance companies, and we start serving, and no offense, when we start serving the government, that's a problem, man. That's where we get this problem.
It's true.
All right, so let's see. I like what she's saying here. Let's go. Physicians are joining large group practices in hospitals because the financial component of contract negotiation is removed. Physicians are largely paid by the RVU. Do you know what that means?
So an RVU is the units that people get so everything is based on a service has a number of RVUs associated with it. So a normal, doctor's visit might be, 100 RVUs, whereas a surgery is 2,000 RVUs. So it's a amount of payment per unit. They basically are saying how much your service is worth, and RVUs are based on by insurance, and
okay,
how they determine how much to pay a doctor. That's why specialists like subspecialties like brain surgery, they have huge RVUs, whereas a doctor visit and your primary care doctor has relatively small RVUs.
Okay.
Neurosurgeons are millionaires and family doctors are not.
Right. But you're willing to just shrug that off, right? You're just willing, like, you're a community guy. I know you're Boy Scouts. I know a little bit of what you're going to be at the baseball games. Like, damn, man, I love that. I love it.
The medicine came to me from Boy Scouts. I actually I was about 12 years old, and I was doing first aid merit badge, and I said, I love this. How do I make my whole career first aid merit badge? So I was also taking biology course in high school, and I said, science, first aid merit badge? How do I do that? Be a doctor. So that's from 12 years old, I knew I wanted to be a doctor because of Boy Scouts. And because of Boy Scouts, this is why I'm doing the way I'm doing this now, is because I'm actually a scoutmaster for my troop. And I teach my scouts and I teach my kids. I say, listen, if you run into a problem with a system, there's three things you can do. you can basically suck it up, learn to live with it, and just deal with whatever comes. That's number one. I don't like that very much because I don't like being told what to do. Uh,
Welcome to the Libertarian Party. I was waiting for that. Damn, I got you, man. I got you. Go ahead. Keep going, man.
Number two, you can try to change the system from within. You can get on the committees. You can try to get a leadership position yourself. You can try to bring your thoughts and your ideas to the leadership and say, hey, listen, I have a better way of doing this. How do we make this happen within the system? Well, I've been practicing medicine out of medical school for 15 years now, and that has not worked.
Right.
So now I'm going into the third thing that you can do. If you can't live with it, you can't change it from within, it's time to go out and blaze your own path and try something else. And that's what I'm doing.
Go around it. And that's what we're trying to do. Bam, my supporter right there, my number one supporter. So check this out. Do you know who Larry Sharp is?
I do not. Tell me.
All right. This is good. We're having a blast, so I'm going to let this. We're running this out a little bit. So David Weiss, he wants to buy his medicine with Bitcoin over the internet. What do you think about that?
I do own Bitcoin. I think that in general, the idea of digital currency is indeed the wave of the future. And if you don't hop on it sometime soon, you will be forced into it because that's just how technology is going to go.
Blockchain, digital currency. That's it. We're done. You get a card, you get a number, boom. We track everything. But that, first of all, I like the theory behind Bitcoin. Okay, the privatization of a transaction between you and I is technically possible with Bitcoin. We can cut the government out of everything, man. And I love that.
The government is trying to get their hands into it right now.
Yeah. So, Mark, is David a libertarian? Is that what's going on here? You have secret libertarian friends?
I was not aware that David Weiss was a libertarian. He's a friend of mine from college.
All right. But he feels like, all right, I'm liking what he's saying. So we're going to go with that. So actually, let's go to who Larry Sharp is for a second, because Larry Sharp supports me. Larry Sharp answers my questions. Larry Sharp ran for governor against Andrew Cuomo. And what he managed to do was guarantee libertarians ballot access for, I think, the next 2 election cycles. I'm not a detailed guy, man. I'm a campaigner, right? I'm out here. I want to meet people like you. I want to have conversations like this. That's what I'm doing. That's why I'm running for Senate. I want to convince kids like Andrew to, run for office as a libertarian and bring libertarian ideals to our governance. So going back to Larry Sharp ran for governor in New York State. He managed to get 125,000 votes. Okay. And that did, in fact, guarantee us ballot access. So that is, in fact, why I ran as a libertarian. So I was going to ask you, we had maybe, and guys, we're winding this down, so likes and shares are important. And I'm going to tease Dr. Mark here for a minute, unless we get some other comments, all right? We were talking, and you were kind of leaning towards, yes, an ANCAP, all right. And that, yeah. You were kind of leaning towards Joe Biden, right? Am I correct? We were saying, and again, guys, let's not take any of this serious. This is just 2 guys hanging out, maybe having an adult beverage and having a conversation. So I said, maybe I might ask you who you might vote for president. And you said if you had to pick one of the 2, you would pick.
I would pick Biden.
All right. So if anybody out there in Facebook land wants to offer Dr. Mark a different choice between Trump and Biden, and guys, listen, I'm almost a Trump supporter. He's got a third-party vibe. He says crazy stuff. I forgive him most of the time. He spends too much money. He's a populist. I don't know. But anyways, if anybody out there, Facebook clan, has a suggestion, let's hear it. There is, Dr. Mark, a libertarian candidate for president. Did you know that?
I did not. Who is that?
Well, her name is Jo Jorgensen. All right. So, and guys, listen, I'm not saying that you got to vote for Jo Jorgensen. And I'm not even, there we go. Here it is. I knew this guy would have it. I knew it. I knew it. My buddy Ryan, we have this analogy that we've been working on this, that the Democrats and the Republicans are Coke versus Pepsi, right? And RC Cola has always been the best soda ever. And we got Coke versus Pepsi pretending to fight, and they're building their market share. And RC Cola gets left over here with the Keurig. You know what I mean? It's just like, oh my God, man. So, yes. And Joe, not Joe. J-O, yes. J-O, not Joe. It's a big deal. She and here we go. Your buddy David Weiss knows who she is. She's a psychologist. She's a lecturing professor. She's interesting. Based on our conversation, Dr. Mark, I don't want to push anybody. I don't want to force anything on anybody. Okay, but if you check out some of our campaign platforms, you might just go, we could do that. And listen, guys, this conversation, Dr. Mark, I have fun talking to people. I seek out conversations like this, but this ranks in my top 5. I'm not even kidding you. I had a blast. You're knowledgeable about the subject. And guys, we are the wedge, man. Me, my wife, Ryan Bedford, you, Dr. Mark, whether you like it or not, we're the wedge that's going to drive these guys apart. They're going to start serving us again. You know what I mean?
Thank you.
Oh, Dr. Joe plays hockey. Do you like hockey?
I don't really play hockey.
So listen, guys, as soon as Dr. Mark, any information that you have that you want to make available, you let me know. As soon as you're ready to start taking patients, we're going to fill up your practice. I guarantee it, man. That the need for what you're doing is incredible. It's perfect. It's well-timed. And I know you didn't necessarily create it. You gave other people credit, but you're putting your, I don't want to use the word, on the line to make something happen for a community that has seen a school die, seen their property taxes go up, seen their insurance costs go up, seen their jobs close, seen their farms go away, and watching houses fall into the ground. And you're taking the risk to get out there and do this deal. All right, make something better in upstate New York. And man, I want your endorsement, but I'm not going to ask for it. But I endorse what you are doing, and I want to thank you for being here with me, brother.
Thank you. Can I give a plug for my website?
Please, man, please plug everything. You go, man, go.
So, BarrettoFamilyMedicine.com. My name is spelled with 2 R's and 1 T. My motto is your friendly neighborhood doctor. You can like me on Facebook at Barretto Family Medicine. I opened July 6th, which is actually just around the corner. Again, I'm loving to see as many people as we can. Same day access, 24/7 access to me, unlimited visits, free meet and greet, by the way. If you guys just want to come in and talk about it and see if this is something that's right for you, the first visit, it's an hour, it's free, and just to see if you like what I have to offer for you, and then we can decide afterwards.
My wife is from Montego, so she endorses what you're doing.
Great.
We got my buddy Ryan saying thank you. Other people are saying thank you. Listen, Dr. Mark, if you have any information I can put on my page for you or my regular page, I believe me, I will do it. I love what you're doing. Your buddy David Weiss is not just a libertarian. He literally knows who Spike Cohen is. He is going to be reaching out to you on Facebook to have you take a look at Joe and take a look at Spike. And you got questions, you can reach out to me. You got questions, you can reach out to him. This is good stuff. And if you have a podcast, David, friend me, check out my page. You and I can do work together. I don't care. I'll do anything. We're going to make this, we are working hard to make society a better place. Just like Dr. Mark. And again, last time for tonight, I welcome you to the Libertarian Party, sir. Thank you very much. All right, I'm going to end the broadcast now, man. I had a blast.
Thank you for having me.